2D ultrasound has been used in the assisted reproductive medicine environment for many years to assess for uterine and ovarian anatomy, pathology, and follicle monitoring. The introduction of 3D imaging provided access to new imaging planes not accessible with 2D imaging, further enhancing the evaluation of uterine anomalies and pathology. 3D ultrasound can also play a key role in follicle monitoring. Serial evaluations of stimulated ovaries during the reproductive cycle can be time-consuming and tedious with 2D imaging. The use of 3D allows the user to capture the entire ovary and follicles with a single sweep, decreasing the time required for scanning. 3D volume acquisition also allows the user to store the volume for re-evaluation later in the cycle. SonoAVC Follicle is a dedicated reproductive medicine tool on all Voluson systems designed to calculate the number and volume of individual follicles from a 3D ovarian volume. This semi-automated approach can help reduce the exam time, increase consistency among users, and enhance patient comfort during follicular monitoring. SonoAVC Follicle now provides 3 flexible workflow methods to help clinicians choose which method best fits their individual workflow. At the press of a button, SonoAVC Follicle provides the number of follicles as well as dimensions and volumes of each follicle within a defined region of interest. SonoAVC Follicle SemiAutomated Method allows the user to control which follicles to measure. By simply clicking on a follicle, dimensions and volume are calculated, then accepted by the user. SonoAVC Follicle Manual Method enables the user to benefit from the use of volume ultrasound for efficient image acquisition while retaining the familiar measurement method that they use today. Each method can enhance workflow, help reduce exam time, and enhance patient comfort. To perform SonoAVC Follicle, simply obtain a volume of the ovary. Ensure the volume region of interest or ROI box includes the entire ovary, and the volume angle is set wide enough to ensure the entire ovary is captured in the volume. Once the volume of the ovary has been obtained, use the trackball and set functions to choose volume analysis, and then SonoAVC Follicle. Selections from the left monitor menu can also be accessed by using the alphanumeric keyboard shortcuts. Once SonoAVC Follicle has been chosen, choose the preferred measurement method. With SonoAVC Follicle Manual Method, first choose which ovary is to be calculated. Once this choice has been made, the volume display will change to a single plane, which was the A plane from the volume, the plane in which the volume was acquired from. Next, use the parallel shift control to slide to one side of the ovary. Measurements can either be performed with calipers or with an ellipse function that can be defaulted as the primary means, or easily selected at any time. Place the calipers on the follicle with the trackball and set functions on the console. After 2 measurements are performed, the system will complete the calculation for that follicle and will be ready to measure the next. After you complete all desired measurements in a specified plane, parallel shift through the volume as desired to the next plane you wish to perform measurements on. As measurements are completed, you'll notice that numbers appear in the follicle. These numbers correspond to the growing list in the menu on the left side of the monitor. These follicles display in order of size, with the largest on top, so you may notice numbers within the follicles changing as measurements are completed. This is normal, as more follicles are added and reordered in size from largest to smallest. Once you've shifted through the entire ovary and completed all measurements, select Add to Report from the left menu to complete the measurements for the ovary. With SonoAVC Follicle Semi-Automated Method, obtain a volume of the ovary in the same way described in the manual method. From the SonoAVC menu, choose Semi-Automated Method, and then choose the right or left ovary. The display will once again change to show just the A plane. Use the parallel shift control to slide to one side of the ovary. Use the arrow on screen to select a follicle by pressing on the top Set button around the trackball labeled Add Remove. This will calculate a 3-distance measurement from the follicle volume based on the best-fitting ellipsoid of that follicle. To continue measuring follicles, click on each one in the same manner and use the parallel shift control to access other planes within the ovarian volume. Again, you may notice numbers within the follicles changing. This is normal. As more follicles are added, they will be reordered in size from largest to smallest. Once you have shifted through the entire ovary, select Add to Report to complete the measurements for the ovary. At any time, a manual measurement can be performed by selecting Add Manual from the Monitor menu. With the full SonoAVC follicle, obtain a volume of the ovary in the same way. From the SonoAVC menu, choose Auto. However, before the right or left ovary is chosen, ensure the ovary fits into the region of interest. This ROI is the area that is analyzed for the hypoechoic areas that will be interpreted and measured. A best practice is to ensure the ROI box is placed close to the ovarian borders, so as not to interpret surrounding fluid or other hypoechoic structures into the SonoAVC follicle analysis. Once the ROI is set, select the right or left ovary. The ROI will be analyzed, and the result will be shown in the lower right quadrant of the image with corresponding calculations on the left menu. The flexibility of SonoAVC Follicle allows each user to select which method best meets their workflow needs. All measurements are sent to a comprehensive report. In addition to the dimensions and volume, SonoAVC Follicle can also calculate a relaxed follicular diameter. This is a diameter based on the follicular volume and would be a diameter if the follicle is spherical, as if it were not under the pressure from the surrounding follicles. The follicle report also includes a graphical display of size and number of follicles that can be plotted during the menstrual cycle. The Voluson Signature series offers innovative tools and extraordinary image quality to address the needs in assisted reproductive medicine. SonoAVC Follicle, together with the Voluson brand of 2D and 3D technology, can help provide enhanced workflow and help achieve reproducibility and standardization benefits to your practice.